You're listening to the Jōrni Podcast. Can our thoughts actually change the physical health of our cells? Find out more in today's episode. Hi, I'm Petra Brunbauer. What if everything we've been told about holistic health, healing, and well-being is only part of the story? Because thriving in today's world looks different than it used to. Here, we challenge the narratives, rethink what it means to become human, and explore how that shapes the way we lead, live, and step into our full potential. This is the Jōrni Podcast. Welcome to today's episode. Healing involves more than managing symptoms and invites us to recognize what may interfere with our innate capacity to restore balance. When we include consciousness, intention, and physiology within the same frame, chronic illness is understood through a multidimensional lens that reflects the complexity of lived experience. Dr. Helané Wahbeh is the Director of Research at the Institute of Noetic Sciences and a former president and current board member of the Parapsychological Association. Dr. Wahbeh is trained as a naturopathic physician and holds a Master of Clinical Research along with 2 post-doctoral research fellowships. She has published and spoken internationally about her studies on complementary and alternative medicine, mind-body medicine, extended human capacities, stress, post-traumatic stress disorder, and their relationships to physiology, health, and healing. Dr. Wahbeh is particularly recognized for her research on channeling and her noetic approach to it. Here is my interview with Dr. Helané Wahbeh. Hi, Dr. Wahbeh. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because we will be talking about some holistic pieces of healing, of mind-body medicine, and whatever else we fit in there for our listeners. And I feel that you are just the perfect guest to come on this journey with. So thank you for joining me today and welcome to the podcast.
Thank you so much, Petra. It is a pleasure to be here with you. I'm excited to talk about all of these topics.
Yeah, I feel now probably more than ever, these topics are so much needed in the world and people are looking for information, looking for answer, looking for new perspectives. So I think this is a very timely interview to have now and to explore some of these topics together. For starters, would you like to share maybe a little bit about yourself or the parts of your journey or your story that you feel connect to what you do today? And also share with our listeners a bit about what it is that you do today.
Yes, so I am currently the Director of Research at the Institute of Noetic Sciences, and this is my dream job. And I'm so grateful to be leading this incredible multidisciplinary team looking at all things consciousness, and especially how our consciousness expands beyond the physical world. And I know we're going to dive into that a little bit more. But the other thing I want to share about my background is that I was trained as a clinician, as a naturopathic physician. And so I've always been very curious about health and healing, most especially how the mind and emotions and psychology affects our health. And I was on a path to go to regular medical school, and I was at UC Berkeley. I was sitting in a medical anthropology class, and a naturopathic physician was a guest lecturer and shared about naturopathic medicine, what it means. And my mind just exploded because their philosophy totally resonated with me. This idea that we actually have an innate ability to heal ourselves. That's just part of our makeup, to focus on prevention, that the doctor is an educator, not a God or that we project our authority onto, but they are like a cheerleader, a teacher that supports us on our health path, do least harm. Anyway, all the tenets of naturopathic medicine just really wonderfully resonated with me. And my training to become a doctor was so rich and varied and full of the various ways to empower people to heal themselves. It's like we have a toolbox of various tools, and then we work with the individual to see, okay, what tools are going to best work with this specific person. There's no one size fits all. And so that theme, I think, has really filtered into my research life, where I really focused on mind-body medicine and meditation research, and bringing me to where I am now, working on consciousness. And we can absolutely delve into that because there's so much there in its relationship to health and healing.
Yeah, thank you for sharing that. And I would love to know more about that. I feel this is a huge topic, and maybe you want to guide us a little bit into where we start with this. I think more and more listeners are probably aware of, as you said before, that we have this innate ability to heal. Although many people still aren't empowered to take charge of their own health and aren't really empowered to be their own advocates. So where do we go with that when we come into more the consciousness part, and how does that connect to our healing journeys and our well-being?
Yes, this is so vitally important. And especially in the West, we have a medical system that is incredibly excellent at specific things. If I get in a car accident, I'm going straight to the emergency room and may have to have surgery. And our current model is really wonderful at specific like traumatic injuries or surgeries or things like that. And yet it's not doing a great job around chronic health and illness. And we could talk for hours about our ideas on how to fix our Western medical system, but I don't think that's really what we want to focus on. But an important point that I think is so vital is the philosophy underlying the different models. So in the current Western model, you have a symptom, and usually we want to get rid of the symptom. And it doesn't always get to the root cause of what's causing the symptom. And this is really funny because you imagine driving your car and the red oil light coming on and being like, oh, my oil light's on. I'm going to clip the wire so that the oil light doesn't show up anymore. Oh, great. I got rid of the symptom. Your engine's going to totally explode if you don't deal with the root cause, which is my car needs more oil. And so I think holistic health and bringing consciousness into healing is a way of getting more to the root cause of the imbalance, that we get to the core issues that are often mental, emotional, spiritual, that are underlying the physical symptoms that are arising. And I want to make sure the audience knows I'm not saying don't deal with the physical symptoms. I think that it's a multi-layered approach. But if you just deal with the physical symptoms, often you don't get to cure because there's so many other layers that are not being addressed. And so that's what I think is so exciting about what's called alternative medicine or complementary integrative medicine, is that excellent practitioners focus on what is the cause, what is causing this imbalance in your system. And then coming back to this consciousness piece, related to this kind of dichotomy of different worldviews, our dominant paradigm says that all that exists is the physical world. It's called physicalism or materialism. And in that model, our consciousness is generated by our brain, right? That consciousness arises from the firing of our neurons, and its actions are limited to our brain and our body and making our bodies move around. there's a lot of growing evidence that shows us that our consciousness actually isn't created from the neurons of our brain, that perhaps our brain is a tool that either filters or is a receiver of consciousness, and that our consciousness can actually affect the physical world. That, say, my positive healing intention, which is a combination of attention, where I direct my attention, and my focused will, I put my positive healing intention towards affecting something, whether it's my body or a loved one's body or cells in a petri dish or plants, that we can actually see effects of our intention affecting the physical world. Now, if you're in the physicalist camp, you say, that's impossible. There's some other reason, because there's no way that our consciousness can go outside our brain. But we're seeing more and more scientific evidence demonstrating we're actually seeing these results. So how do we explain that? Maybe consciousness isn't generated from the neurons, and there's some other model at play for our consciousness being what we call non-local and not attached to our conventional notions of time and space. So I'll pause there to see if you have any thoughts or comments on that. There's really a lot of studies that have shown this in people, in animals, in cells, in plants, in quantum number generators, you name it. We have a lot of studies showing that there is a significant effect of intention.
Wow. Thank you for that. And also thank you for describing the car with the oil light. I think this is amazing for our listeners to get a sense of what we're actually doing when we're talking about our healing and our well-being. So I love that. And yes, you're touching on something very curious here. And that is, of course, that if our consciousness is, as you said, non-local and extends beyond our body, beyond our brain, beyond all of that, what does that mean for our healing? Does that mean in some way we can harness that? Does that mean we can, as you said, use this as a tool somehow? So for me, there are a lot of questions that make me very curious when we say that maybe it's not generated by our brain. What does that mean for us? And of course, if we connect this with intention, we already know, as you said, that we can affect things not just in our own bodies, but also outside of our bodies with our intentions. So it becomes very interesting on how we can now look at our own healing in light of some of this evidence, as you said, that's becoming more and more well known. And what is your experience when we say, okay, now we're studying this a little bit more, we know a bit more about this. What does that mean as a human for my own power to heal, my own access to healing when consciousness might not be in my brain? Does that give me more options? Does that give me more access to being well?
Yes, absolutely. That's why I feel it's so empowering. And I think the first step around this is to be aware of this possibility even, and to be open and curious about that. Because in our kind of Western world, we're trained to look outside of ourselves for answers, to look outside of ourselves for wisdom. And so I feel like this alternate view of looking at things. I'm saying alternate for the West because there are many cultures around the world that don't ascribe to that physicalist worldview at all. And so I just want to be careful to say that this isn't new news at all. And we're just coming back to it on some level. So we're trained, okay, the doctor's going to fix me, or I'm going to look at this, Google online what I'm supposed to do, or it's all outside of ourselves. And that's not to say that information can't inform us in some way. And yet, if we go internally to say, what am I actually feeling? If I take a few minutes to just close my eyes and feel into my body, feel into that dis-ease, be loving and compassionate and present with it, with the intention of healing, with the intention of being curious. I really want to know, what do you need? Like, what's missing? What's creating this dis-ease in you? And how can I love you and support you? I've seen it with my patients. I've heard so many anecdotes that pathways just reveal themselves. And they're not straight lines usually. They're often curvy. And yet there's an incredible sense of empowerment and gratitude and appreciation for the body, instead of, oh, it's just this machine I need to fix. There's a lot more love and curiosity around our bodies and honoring them as these amazing vehicles that we move around in. So I think it's incredibly empowering and inspiring. And if I could give one piece of advice for the listener, it would be, if you don't already, to set aside, even if it's just a few minutes a day, to go within, to be present with yourself with a positive healing intention, and just be in that, be with yourself and see what arises.
Yeah, I love that. And thank you for sharing that. I do feel that through all the busyness of our lives and all the things that we do every day and that are expected of us, we very often lose that connection to our own intuition, and to take that time to really sit down and tune inwards and say, what is it that I actually need? Or how can I support myself more, better, differently? And just listen into that. I did notice that I didn't do that at all until I became aware of that, that I didn't do that. But it's such a simple sounding thing. And yet I feel it has a huge effect on how we reconnect with ourselves, how we inhabit our bodies. Also, I want to say, just start to trust ourselves again. That was a big piece that came back when I allowed that intuition to reconnect, to build self-trust in my body, in myself. So I feel for listeners, there's a huge nugget there that you just gave them by just simply becoming aware of that connection, and just keep fostering and supporting and loving that. Yeah, thank you for sharing that.
Yeah. And I can imagine some listeners being like, oh, that's too simplistic, or I really get that pain can be debilitating and it can feel so overwhelming and so complex, especially if you have multiple health issues going on. I really get the angst and pain and suffering of that. So I'm not diminishing that in any way by suggesting this. And yet it does sound simple, and yet it's incredibly profound. And that's why I invite people, even if it's 30 seconds, just to attempt as best you can to be in that unconditionally loving, positive, healing intention space with yourself, to allow yourself to just be in your own presence with positive regard, is so incredibly transformative. And the mind wants all the answers immediately, but often our intuitive self unfolds like a flower, and it just gives you the next step. And maybe in those 30 seconds to a minute, you might get an insight. You might see a food. I don't know, I'm just making some random example up. Like maybe you see dairy and it's, oh, wow. And it comes with a contraction. Okay, maybe I need to cut out dairy for a little bit, and just experiment with that and see what happens. You try it for a week or two, and you might find, wow, I feel so much more energy. I feel so much better. That was an incredible intuitive insight for me to look into my relationship with that specific food. Or maybe nothing happens and you don't notice anything, and that's totally fine. But every day you keep going into that inward facing state to ask for wisdom, to be in that positive, loving regard for yourself, and see what happens.
Yeah, absolutely. And 100% I agree with what you said, but there are many people that are on journeys with chronic conditions, chronic illnesses, chronic pain as well. And yet I do believe that what you just shared, it does make a difference just in how we experience this journey. in my own journey, just becoming aware of that and reconnecting actually changed for me how alone I felt in that journey. So I do feel there's a profound effect that we can have, even if our pain is very high or we are suffering to a large degree, there's still that piece that can reconnect us. So a little foundation, maybe a first step, right, on that journey. Yeah, I think that's wonderful. And I do feel that as you're saying that, that is part of the intention that you were talking about as we're becoming aware and we're intentionally spending that time with ourselves, maybe just the 30 seconds or the 5 minutes, but we are placing our focus and our attention on ourselves during that time. Where this intention for ourselves to be well or to heal or simply just to be, where does that connect into our healing journey?
I think the power of intention is quite profound. And like I've mentioned, there have been numerous studies demonstrating that positive healing intention creates effects. And we've seen this in human studies. We've seen it in plant studies. We've seen it with cells in petri dishes. We've seen it with animal studies. We just finished a study that was a collaboration with others with mice, with someone directing positive healing intention with mice with cancer that found positive results. So what's fascinating is that the results are small. It's not like immediate miraculous cures, but there is definitely an effect. And it's usually like about 0.2, sometimes as large as 0.3, but they're small effects. And yet they're there. And if that's something that we could do just by thinking about it, then why wouldn't we? And I've done a lot of thinking about and researching around intention and how that translates to like the daily life. Like, how do you actually intend in a way that's effective? And I teach a whole course on this, so I'm going to try to be essential. But there's two pieces that I think are really important to understand about that, about directing your positive healing intention. And so I mentioned this piece about attention, right? So anything that you can do that strengthens your attention or where you direct your mental thought process is amazing, whether it's meditation or martial arts, or those are the two that are coming to mind right now. But our attention is like a muscle and you need to work it out. And you need to go to the attention gym and learn how to have your mind focus on what you want it to focus on for some period of time. So that's the attention piece. And then the will, this directing of our will with our intention. I intend to have unlimited energy or whatever the intention is. It's hard to describe what that's like to direct our will. I usually feel it in my heart space or just below that in my solar plexus when I direct my will and attention to a specific thing. And so some people, there's practices where it's, okay, I want the red Corvette and I visualize getting the red Corvette. And it's very like externally directed, if you will. And I think there's probably a way for that to work. But what I've seen personally to be most effective and with people I've worked with, although there haven't been a lot of research studies on this, is the feeling of the intention is that it's already done. It's like you choose what you want to manifest and then you pretend like it's already happened. As best you can, you are in the state of it being realized. And that might be hard to grasp for just kind of beginners in this topic. And yet, again, it takes practice. If you can hold that state for just a minute. And our minds are incredibly powerful and they have an incredible imagination. And so you can really work with your mind, or you can draw it out, or you can create a symbol, or you can find different ways to help you feel like your goal is actually already realized and holding that. The other piece I want to mention is around looking at our underlying motivations. Now, with the red Corvette, it's okay, why do I want that? Is there really a non-ego based reason for me to have a red Corvette? I think it's a little simpler with health. I think it's a innate right, if you will, to feel good in our bodies, to be healthy and vibrant and be able to move around in the world in the ways that we want to. And so really bringing awareness and witnessing to our relationship with our bodies and our relationship with health and our relationship with disease and sickness. I've worked with a lot of people who actually got a lot of benefit from being sick, whether it was attention or increased support. And these are very natural, normal human defense mechanisms that we strengthen often when we're children. And so I have no judgment or criticism around that. But if those defense mechanisms and patterns are unconscious, they can totally hijack our pathway to healing. And so there are many different tools available to learn how to do that. To say, okay, I want to witness any patterns that are unconscious so I can just easily clear them and they won't block me from my healing path. Anyway, I've gone on and on about that. I don't know how you think about all that.
Thanks for taking us on that journey. And again, I couldn't agree more, because that's exactly what happened when I was in a wheelchair about 5 years ago. I didn't come out of that wheelchair until I realized what some of those side benefits were for me of having that identity. I then could just say, oh, well, I can't be visible. I can't do it because I can't move. These were stories that I was telling that kept me from healing. So I can very much connect to that, and just put out there for listeners also that these aren't things that we do on purpose, and they're not things that we do to make ourselves in any kind of way better or worse. They happen usually subconsciously, but resolving them can have such a profound impact on our healing, and actually finding out what we're hanging onto in these situations. What are we telling ourselves? What are the stories? How do we actually see that protects us in some kind of way if we have that identity? So yeah, such an important piece, I feel, of the healing journey. So yeah, thank you for that. And absolutely a huge part of the work, I think, in healing went into exactly that piece.
Yes, absolutely. And I think some people get really afraid of that process, that once they go there, it might be overwhelming or too much, or bring up emotions that are challenging to deal with. And so you can set the intention that what is revealed is as much as you can handle, and just do it in little tiny chunks, and trust your internal wisdom, your intuition, to, with that willingness to just take one tiny little baby step on that path. It doesn't have to be all at once or overwhelming. You just say, okay, just show me the next tiny little bit that's going to help me, and then see what arises.
Yeah, absolutely. And I do feel that any of our listeners can do that, because my excuse, I'll put this in air quotes, was, oh, I'm not good at meditating, or I'm not good at this or that. But that's not really what that healing journey is about for you, and that attention. So I feel that anyone can do that. Anyone can bring back that skill that we may have gotten disconnected from, of our intuition and of our own intentions, awareness, all of those things. So it is something that's accessible to all of us and that any of us can work with. So I think that's also what makes that so empowering.
Yeah, absolutely. And I think another piece I want to highlight here is that everyone's path is unique, and everyone, the way they experience these aspects is also very unique. And at my work, we call that the noetic signature, which is a unique way for how our intuition shows up for us. And you might feel things in your body. You might get a visual image in your mind. You might hear words coming to you. There's so many different ways that this kind of intuitive wisdom might arise for us. And being in exploration of what your specific noetic signature looks like can really support that. Maybe you can journal because you're very verbal and you like words, and you can write a question in your journal, like, what's the core pattern of this symptom I'm having, or something like that. Or maybe you like visuals and you draw and can draw pictures out. Anyway, or you're very embodied and you need to actually go, your meditation is actually to be on a walk and setting the intention while you walk gently to get answers for your questions. I'm just highlighting that there's no right way to do this and no wrong way. And it really is about setting the intention to be on that path and actually moving more into an allowing space of letting the answers arise within you, letting that increased curiosity, that increased love for yourself to gently blossom. And as best you can, noticing when you look outside of yourself for the answers, catching it and say, okay, that's interesting information. And I'm going to combine that with the information I'm getting from within. And that's going to best help me make decisions and best decide on the next best step on my healing path.
Yeah. Oh, that's beautifully said. And yes, I think unique to each human being, right? How we come on this journey and reconnect. Beautiful. I'm wondering a little bit, you mentioned in the beginning when we first started speaking that we focus sometimes a lot on the physical and we're missing some of the emotional, the mental, the spiritual aspects of that need to go into that healing piece as well. By becoming more aware, by becoming more intentional, are we in essence opening ourselves up to those other pieces? Or how do we bring in the holistic approach to our own healing journey?
Yes, that's a wonderful question. And as you were sharing, it reminded me of my own personal journey when I began learning how to meditate. And there was a point where I realized that I was not my emotions and that I was not my thoughts. And it just completely cracked things open for me. It's, oh, what do you mean? Oh, these emotions are actually just moving through me, but I am not the emotions. Oh, these thoughts aren't me. I can actually watch my thoughts moving through. I'm very visual. And so the way I experience it now is that it's like I'm the layer of the onion metaphor has probably been completely overused, but that there's layers of Helané and they combine in this really awesome, cool way to become me, but that I can really attend to and be in relationship with each of those layers in different ways. So I can tune into the physical aspects of my body and be like, okay, what are you needing? Oh, this is tight here. Okay, I need to work with that in a certain way. Okay, what is my emotion? Where are my emotions right now? What emotions am I feeling? Where are my thoughts? Is my mind super busy or calm or quiet? And actually bring awareness and attention to each aspects of those pieces. And then underneath all that is that kind of core witness Helané self that feels interconnected with all that is, that can feel a deep well of love. And to me, that's my spirituality, if you will. And I imagine that that may show up for people in very different ways, depending on where they're at. But all these layers make up me, and I can be in relationship with each one of those. And as I work with my trying to get at the cause of any symptoms I might be having, I will explore each one of those layers, if you will, in as holistic way as possible. And sometimes I can't see it. And then I intend, okay, please show me what I'm missing. This is a blind spot for me. Where is this coming from? And so it might be, like I said, like a food thing. It might be an environmental thing or something I'm bringing into my body, or it might be something coming from within.
Yeah, absolutely. And that is often, I think, when we've come to this place where maybe we just took pills or we just put a Band-Aid on whatever was going on, there is that space that we can come into to start exploring and to reconnect with curiosity, to open up all of these holistic pieces in our own healing journey. So thank you for sharing your own story on that. I feel it always helps to hear a little bit about someone else's story, to know that we're not alone in this and other people are doing this too. So we can do that. We are fully capable of doing that and of becoming part of our own healing journey. Yeah, I very much appreciate you bringing in some of those personal elements. And I'm sure you've worked with a lot of patients and clients as well, where you've seen this in action and actually can see some of the transformations that happen when we come from, as you said, a more physical worldview into a more holistic worldview, and what that does for people. So have you observed that changes things for people, I want to say, in their lives or in their health or their well-being? Do you see that something actually changes?
100%. Anecdotally, working with people, I see it all the time, over and over again. It never ceases to amaze me how powerfully it shifts people's lives in a positive way. And we also see it in our research, all the studies that have looked at quality of life and well-being. And when people engage in tapping into that intuitive wisdom, their lives improve. And we just see that across the board. And the studies that we've done on energy healing and intention specifically for healing, we see quality of life improve, well-being improve. The psychological factors usually improve much more consistently than the actual physical symptoms often. So yes, we see that all the time, which is interesting. We didn't talk a lot about energy medicine, so I'm sure some of your audience have heard about modalities like Reiki and therapeutic touch. We've done a number of studies around that, seeing positive findings. And I do think that energy practitioners are also using positive healing intention, and we can think of them as partners in our health journey. It's not that we necessarily are projecting our authority onto them, but they can work with us and our intention and our energy field with their own modality to remove those blockages in our health and healing. We've done a number of really fascinating Reiki studies where we explored how it works and what the practitioners are experiencing going on, what the clairvoyant seers in the room are observing in terms of energy moving. And what was so fascinating to me, we had one big study with hand and wrist pain. So everyone had hand and wrist pain, but the way that the practitioner cleared the blocks in their system was varied across each person. So it wasn't the same thing causing the same symptom. So they all had the same diagnosis, but the block was in different aspects of their energetic and other fields. So I thought that was a really fascinating finding that we found from that Reiki study. Anyway, just to highlight what you said earlier, we're not alone. And when we do go within, we feel less alone, and it can draw us to people who can support us along that path, that can give us that little activation boost that we need to go one step further.
Yeah, that's actually a really good point that I didn't touch on before. So it does open us up to more ideas and perspectives of possibly where we could go next to find some more insight or more modalities that might work better for us. So yeah, that's true. That did happen for me as well. So thank you for pointing that out, because as strangely as it sounds, looking inside doesn't really sound like it would make us feel less alone, but that's exactly what happened. I was still alone in a sense that I couldn't really explain to others who weren't going through it what was happening. But by connecting with myself, I felt more loved. I felt less alone. And I did start looking more into what could support me in that journey. Yeah, absolutely 100%. And I love what you said about the Reiki studies, because I think it goes exactly to what you were saying before, that the root cause for each one of us is different and unique. And we might all be on journeys for fibromyalgia or chronic pain or whatever it is that we're dealing with. But I think our root causes, whatever these blockages are unique to each and every one of us. So yeah, finding that thread that will start pulling apart that nest that will resolve the blockage. Yeah, beautifully said. And thank you for sharing that.
Yeah, no problem. Because if we hold this idea that we all have the innate ability to heal ourselves, then the question becomes, what's blocking that ability in me? What's blocked? I know it's there. I trust that it's there. I know my body has the capacity to do that. And so what's blocking that for me?
Yeah, absolutely. And I will close our wonderful conversation by just asking you, how can our listeners get a hold of you? And what kind of programs and services do you offer where our listeners could maybe connect with some of these teachings, some of the research that you're doing, or find pieces that might help them on their own healing journeys? Where is best to find you?
Our website is www.noetic.org. That's the Institute of Noetic Sciences website. On there, we have a wealth of resources. All the papers about the studies that I talked about, I didn't really get too heavily into the science, but we have so much science. We have blogs that are much easier to read than the actual science papers. We also have regular free webinars on Fridays, Connect Ions Lives. We have member community events where you can actually speak to other like-minded people on these topics. And we have a number of research studies that, if you're interested, you can participate in on consciousness and intention. And many of them are actually done online. So you can do that from anywhere. You can also check out my book, The Science of Channeling, which is available at all booksellers, that dives into this concept of intuition and how that shows up in various ways for people.
Amazing. Those sound like wonderful resources. And of course, we will be linking to all of those resources in the show notes as well. So be sure to check there. That sounds really interesting to be part of some of those studies and actually be part of how we're understanding things going forward. It's really great that you are offering that at the Institute. So yeah, listeners, check that out and find maybe some of your next steps in your own healing journey, along with other people that you might meet in the community or you might meet in some of the events that were just shared. So wonderful way to dive into a little bit deeper into what we talked about today. And Helané, I just want to thank you so much for being here today and taking the time to share this wisdom that you have accumulated in your lifetime with our listeners and with myself. I'm truly grateful that you were here today. Thank you so much.
Thank you so much, Petra. It's been a pleasure.
Yeah. And listeners, thank you for tuning in today. And I feel that there were so many little nuggets in this episode. Probably be a good idea to go back to the beginning and re-listen and pick out those pieces that were coming all along the way. And thanks everyone for tuning in, and be well until the next time.
Bye-bye.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejōrni.com. Sending you love and courage, and see you next time.